It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
And hi again, everyone. Jim Knox along with Candace Kruger, and welcome back to another edition of the Best Docs Network, featuring some of the best doctors in the entire Dallas-Fort Worth area that help change people's lives.
They certainly do. We're going to start off with our first best doctor. It's spine surgeon, Dr. Michael Rimlawi.
I was in a bad car wreck in 1985. A drunk driver hit me, and I wasn't hospitalized, but it was, I took a pretty good hit to the neck and head. My life had got to a point where I couldn't even walk around the block without being in neck pain. I was having a lot of difficulty at work. I've been playing water sports, and it got to a point where I just had to give them up because it was just causing too much pain for my neck.
When Monty came to see me, he was complaining of a lot of neck pain, and arm weakness. We looked at his MRIs and x-rays, and what we found was a disc herniation was hitting part of his spinal cord and his nerves, and that was causing the pain shooting down his arm.
We had waited several years for the technology to get better because all the doctors had turned us away, but when we came to Dr. Rimlawi, he explained how technology was real advanced now in neck surgery area.
Because of new technologies today, we can perform surgeries that are muscle sparing, and that really is huge because traditionally surgeons cut through muscles, and what we realize now when you do that, that really causes a lot of bleeding, which leads to scar tissue, leads to more pain. So we go in between muscles, and there's a muscle going this way and a muscle going in here, and we go in between the muscles and get down to the neck, and there we're able to shave off bone spurs, take out a disc herniation that's hitting the spinal cord, free up nerves, put in new discs if we have to, and stabilize the neck. And doing that, it makes it much easier on the patient, much quicker recovery, less blood loss, less scar tissue, and it's just not as painful of a surgery at all. And a lot of times patients really experience very little pain.
I'd had surgeries before, so the day of my surgery, it was only supposed to be about an hour and a half long, so I wasn't really nervous, but I was excited to have it over. And so when I woke up, that's the first thing they asked me if I had neck pain, and I had no neck pain. So after 10 years of neck pain, I'm finally able to go back to a normal life because of Dr. Rimlawi.
I decided to enter the field of bariatric surgery and focus my practice and also become specially trained in this field because it has such a profound impact on patients' lives. Patients have been struggling for years with multiple medical conditions and sometimes even low self-esteem, and when they come to my office, I can offer something that really can be successful for them.
I decided to have the sleeve procedure when I got tired of being tired and not feeling good. With me being overweight all my life, I had a doctor tell me one time, he said, "Vicki, your knees were not designed to carry what you are making them and have made them carry your whole life." Before I had the surgery, it was always hard going on vacations because walking anywhere, I can remember a few years ago, I went on a trip to New York with my daughter and I thought I was going to die. Needless to say, I was always the straggler. We did everything through the subway, up and down the stairs. It was horrible.
So it's really exciting to work with patients and then perform surgery and also work with them for their lifestyle change and then see the changes happen. And the great thing about bariatric surgery is that I have a lifelong relationship with patients. I see them post-operatively, I see them for years afterwards, so I can see how they're doing in the short term and in the long term, and see them come off their medications, see them lose weight, see them gain energy and feel great about themselves. And the most important thing is that they're able to live longer, have a better quality of life in the end, and be able to enjoy that with their families.
Dr. Malladi, I just can't say enough good things about her. She is a genuine person. She's a very caring person. If somebody said, we were going to shoot you if you do not say something negative about her, I'd have to go shoot me. I've lost, since I've had my surgery, 85 pounds. I feel fantastic. I feel like I look good. I just feel so much better. I feel alive.
Our bodies need at least 90 milligrams of vitamin C each day. The best way to get your vitamin C is making sure you eat at least 5 servings of fruits and vegetables every day.
Well, psoriasis is a fairly common disease. We see a lot of that in our practices, and probably a good way to think of it is normally it takes your skin about 6 weeks to grow from the very bottom layer all the way to the top layer. In psoriasis, that's accelerated up to about 2 days. So your skin is just growing much more rapidly than it should, and it's causing a lot of scale to develop, and it's associated with redness and a rash that you see. But it's mainly just the skin is really growing far too rapidly. Psoriasis can affect people at any age, but it tends to be more common in adults. Most people who see that develop psoriasis are probably in their 20s, teens, sometimes a little bit older. And it just kind of comes out of the middle of nowhere. Sometimes people can be under stress and can develop. Sometimes people can get an infection, like sore throat, and they'll get what's called guttate psoriasis. You get a widespread eruption of lesions that develop, and usually that kind of goes away after a relatively short period of time. Most cases of psoriasis do tend to run in families. There tends to be a genetic relationship to it. So someone in your family tree probably had psoriasis somewhere along the way if you get it. Just like atopic dermatitis can be worsened by bacterial infections like staph and strep and things of that nature, psoriasis can too in some cases. And for that reason, in addition to using some of the things like the creams that we use to kind of slow down the growth of the skin, sometimes we use things targeted to try to get rid of underlying bacterial infections. So we'll even recommend bleach-containing washes in some cases, even for psoriasis patients, even though we don't think that's actually directly affecting the psoriasis. If they've got a bacterial infection that's making it worse, you get that better, the psoriasis will get better too sometimes. You do have it for your whole life, but the good news is there are treatments that can put it into remission, and some people go into long-term remission. They may have psoriasis that's really bad for a number of years. With good treatment, it may just go away, and then you can taper the treatment off, and it doesn't seem to come back for long, long periods of time. So it sort of behaves in different ways in different people, and we never really know for sure what it's going to do until we actually treat the person and get them into remission.
For more information about any of our outstanding doctors, as well as request an appointment, head to the website, bestdocsnetwork.com. That's bestdocsnetwork.com. Right now, it's time to introduce you to one of the top plastic surgeons in the entire Dallas-Fort Worth area. It is Dr. John Barnett.
I didn't have Poland syndrome, but it was like it, where one breast is significantly bigger than the other. So I was like a B and a C. It affects everything. The way you dress, the way your wardrobe is, the things you can and can't buy. And as a woman, you want to be able to just go buy it because you like it and you want to wear it, not because of the way it's shaped or formed around your breast area. I just got tired of feeling like that, and I knew that after having a child, it still didn't change. I finally said enough is enough, and I went and saw Dr. Barnett.
Kayla was a special case. This was actually more of a reconstruction than it was simple augmentation. There was nothing simple about that case. She had vast asymmetry in the breast. Asymmetry means one's not the same size or shape as the other. In Kayla's case, this one never developed. And this one was what you'd call a tube sock. Elongated, hanging down. This one was barely there. Usually should have been a two-stage operation. And I told her going in that, you know, I can do so much, but probably you're going to need another operation.
We talked about it and looked at the pictures, and the kind of surgery I needed and required with what I had should have been a 2-step, possibly 3-step operation. And what Dr. Barnett did was just a 1-step operation. And that's all it took.
I was able to, in one stage, create a matched pair. It worked out beautifully. It's been a year now, and she looks fabulous, and she's happy as a clam. Is it rewarding? Yeah, really is. That's a special case.
Dr. Barnett treats his patients like family. He will give you his cell phone number to make sure that you can always be in contact with him if you ever need anything before and after surgery. I'm happy and glad to know that I safely chose him. I've had no complications. You can't even see my scars. He changed my life forever. It was the best decision I ever made.
We all get cuts and may need stitches. How can you tell when a cut that you have somewhere on your body needs a stitch and when it doesn't? Well, there are several ways. One way is if it's gaping open. That's going to be obvious to you. The skin is gaping open, things look like they got to come together, and then you need to go to the emergency room or to your doctor's office. If you're having arterial bleeding, that's spurting blood that pulsates out, as opposed to vein bleeding where it just sort of leaks out. Spurting is obviously not so good. That probably needs a stitch or two. If you see that yellow fatty tissue, then you're deep enough that you're going to need stitches to make this wound heal right. Also, if the wound is over a stretched area on your body, for example, a wound on your forearm, like right here, wouldn't be a big deal to keep together with a Band-Aid, but over your elbow where it bends and opens up with each bend, you're going to need stitches for that. So those are the things to look for. Also, just use your common sense. If it looks like it needs stitches, it probably does.
For additional medical minutes from Dr. Honaker, log on to bestdocsnetwork.com, click on Education and the Medical Minute tab.
We have a very active skincare department as part of our aesthetic practice. When patients come here, we are very proud that we can offer them either surgical rejuvenation or skin care.
I think skincare is your icing on the cake. It's going to help address whatever issues you have for tone and texture and evening out skin color.
Some people are just looking for a more youthful look. They don't really need surgery. So these different facial fillers actually enhance their face and make them look a lot younger.
That in conjunction working with Dr. Wilcox and his specialty of surgery, kind of lifting, and Vicki helping plump out and fill lines and smooth lines, the whole thing just works really well together.
Every patient is specific and every need is specific for that patient. So many of them will tell you, they'll tell you, what they're looking for, and then you just kind of go from there.
Consultation entails me examining the skin, and then I can tell you what I think would be the best protocol for what you have going on, whether it's wrinkles or acne scarring or active acne or sun damage. It's usually a program of products, lasers, and chemical pills that will progress along this way to get your skin nice and pretty and glowing.
Many of my patients range from the age of 25 to 70, and I am seeing a lot more men these days. They too want to look better and enhance their appearance. They're competing a lot of times with a lot of guys that are younger than them, so they too want to look really refreshed too. These treatments stimulate collagen and slow down the aging process. They don't correct, they actually improve your overall appearance.
If we can offer either skin care or surgery, then the patients are comfortable knowing we're going to offer them the best treatment for their particular problem.
Sunscreen is unlikely to stop you from being sunburned or reduce your risk of skin cancer if it is not applied properly. Most people do not apply it correctly and stay out in the sun too long. Be sure to put plenty on and reapply often.
I went to my youngest child's school one day for a parent-teacher meeting and was walking up and down the stairs and just exhausted. And I saw my child look back, just like, "Are you okay, Mom?" And so it was a little sad, and so I just wanted to be able to live life, be able to do things with my children and just not go through it just sad and tired and sick every day.
Lakeisha Green came to see me because she was significantly overweight and was having trouble with diabetes and high blood pressure. When I think about people who are overweight, I think about their diabetes and I think about their high blood pressure. And I think about how that shortens their life. And I think about if there's anything that you can do to get rid of those kind of problems, that's how you're really going to help someone out.
You make up in your mind that this is something you've wanted to do for a while. You think about not being sick. You think about how you're going to feel and how you're going to look afterwards. And I just made up in my mind, and I knew it was right for me to just go ahead and do it and not fear it.
There is nothing other than this kind of surgery that will fix diabetes. What it means is you take the stomach, which is an organ about this big, and you create a small stomach by physically dividing the upper portion of the stomach away from the rest of the stomach. You divide the intestines and bring up part of the intestine to that small pouch and then reconnect it farther on down. So you've changed the pathway where food goes through, and the food no longer goes through the very first part of the intestine out from the stomach, that it changes how your body works related to diabetes. That is such a wonderful thing. It impresses me all the time.
I started noticing I'm eating less, I'm weighing less. I could see it in my face, and it was just an amazing feeling to just know that in a few months, in a few weeks, I was going to be a different person, not just physically, but emotionally. And it has been great.
As always, for more information on any of the amazing doctors you've seen on today's show, be sure to check out our website. It's bestdocsnetwork.com.
You want to head there, check out videos, even request an appointment. Right now, it's time to head to our next best doctor. Is prosthodontist Dr. David McFadden.
I had started very early in my 20s to get a lot of dental work, crowns. And then in my 30s, I realized it wasn't going to last forever. And this created some problems. Not only is it expensive, but it takes your time and it's uncomfortable.
Implant treatment has really been a great technology for patients whose teeth have reached a point where they can't be restored. Teeth that reach that point either have broken off, have decayed, or are just so broken down that we can't use them anymore in the reconstruction process. In those patients who have reached that point, we recommend removal of the teeth and reconstruction with dental implants. Sue had been plagued by a lifetime of dental problems, including decay and tooth loss. She had reached a point where we did not feel comfortable saving any of her natural teeth, so we decided we'd do a reconstruction for her with dental implants.
My friend Kelly is in the dental educational field, so he's very meticulous and precise. So you always go to the person that's best suited to the job. And in this case, it was a prosthodontist. Kelly said this was the only place to do it, and so this is where we did it. And he was right.
Sue was referred by a very close friend of hers who is a dentist here in Dallas. I was honored to get that referral because they had researched her needs and visited many offices before deciding to come here. What they found in their search was that a lot of the other practices were heavy on sales and very light on education. What they liked about my approach was that I simply gave them their options and was able to show them similar cases so they could make their own decision.
Dr. McFadden is very easy to talk to. He can take a joke, he's got a sense of humor, he's serious when he needs to be. He's very thorough, both in the procedures and also letting you know what's going to happen and how he's doing it.
Many times, patients' dental situations have deteriorated to the point where their whole mouth needs to be treated. Many people can't afford that, so we try to stage their treatment in a way that we have good stopping points along the way so they can regroup and plan for the future.
Hi, I'm Dr. Preeti Malladi with Best Docs Network. Did you know that obesity can increase your risk of sleep apnea and that bariatric surgery can help? To learn more, watch my videos on bestdocsnetwork.com.
Carpal tunnel syndrome basically is a problem where you have a nerve that's here in your wrist. That nerve shares a common space. It shares it with 9 tendons. When those tendons swell, that soft little nerve gets pinched. The patient can then begin to have numbness and tingling, and if it's there long enough, can notice that his grip strength or her grip strength has diminished. It's important to treat carpal tunnel syndrome early and not wait too long, because the longer that nerve is pinched, the greater the chance that nerve can become permanently damaged if left untreated.
I've been dealing with hand numbness and pain in my hands and fingers for probably 15-20 years. It progressively got worse, and it got to a point where I couldn't sleep anymore. I couldn't write much more than a check out without a pen falling out of my hand. I would run my fingers through my wife's hair and not be able to feel it on my fingers. And you know, I was missing out on a lot. Keeping me up at night or waking me up at night, it would hurt all the way up into my armpits.
When Steve came to see me in the office and he told me his story, it definitely sounded like he had carpal tunnel syndrome. After examining him and after getting a nerve study to confirm what we suspected, it came back positive for carpal tunnel syndrome in both of his hands. So we proceeded to do the surgery to treat his carpal tunnel syndrome.
The procedure we went with was the endoscopic. I could sleep at night now. I can feel my wife's hair whenever my hands are, run my fingers through her hair. I'm doing just about everything I used to do before.
The good thing about endoscopic surgery is instead of waiting this, a long recovery after one surgery for one hand, we operated on Steve within a week and a half after his first surgery. So he basically had both of his hands done in 1 month.
I wish I hadn't put it off for so long. I don't know how many things I put off because I couldn't use my hands like I wanted to before. I can actually feel my hands and do things, and it doesn't hurt to pick up a pair of pliers or pick up a wrench. I'm glad that I found Dr. Ray, and everything's been great since.
Having a breast augmentation was something that I've wanted to do for a long time, and finally I just had enough courage to pursue it. And my fiance knows Dr. Azouz, so he contacted him and we went and met with him.
Nadia came in with her fiance, and she was complaining that her breasts were too small and saggy. So it wasn't just a question of volume. She wasn't looking just to be bigger. She wanted her breasts reshaped. She felt that her nipple areolas were too low, and she basically, for a woman in her mid-30s, she had very saggy breasts, and she wanted them larger. She wanted to have this done before she got married, and we were planning a breast augmentation and a breast lift at the same time.
And he said, well, I can take you the following Friday, and I went ahead and scheduled it. So I didn't give myself any time to really think about it or contemplate, second-guessing my decision.
There are basically 3 types of implants that we use for breast augmentation today: the saline implant, the silicone gel implant, and the new implant, which is the cohesive gel implant, sometimes called the gummy bear implant. Depending on the patient's desires and needs, the saline implant can work well, the silicone implant can work well, and of course the cohesive gel, the new implant, can work well as well. It's an individual thing depending on the patient depending on what her anatomy is and what I think would work best for her.
The initial consultation with Dr. Azouz was pretty lengthy. He's very thorough. He takes a long time to make sure that he walks you through each step and process.
The surgery itself, it's usually around an hour. The recovery for the breast augmentation and lift can be 4 to 6 weeks.
The results from the surgery, I went from a 36C to a 36 double D. Thanks to Dr. Azouz, I feel much more confident in myself. He did an excellent job with my breast augmentation, and I would highly recommend him to anybody.
Over 90% of diseases are caused or complicated by stress. Some ways to help deal with the stress in your life are exercising, listening to music, writing in a journal, or going for a walk.
I'm a veteran. I've had 13 years active duty experience and been deployed a couple times. My first concussion was jumping out of airplanes in airborne school. Hit my head pretty good. And then in Iraq, shortly thereafter, I was leading my platoon of infantry soldiers. And on a mission, we had our lead vehicle hit by a roadside bomb. The shock of the explosion caused me to have a concussion. And didn't lose consciousness in that time, but had kind of some fogginess for a while. My third concussion was when I had gotten home. I was doing a hand-to-hand combat course and got hit pretty good and actually lost consciousness for 20 minutes.
One of the problems that we're treating here at Texas Sports Hyperbarics is concussions and traumatic brain injury. And it is used to increase the blood flow to the brain, and there is good evidence that the increased oxygen that you get while in the hyperbaric chamber increases or speeds the healing of brain tissue.
I've just started noticing over the past few years several episodes of what I call fogginess. Just where I can't concentrate as well. I've even noticed times where songs that I've sung hundreds, sometimes thousands of times, I'll forget the lyrics right in the middle of the song. Luckily, about a year ago, I met the folks here at Texas Sports Hyperbarics, and they told me that they're doing research on veterans that have dealt with serious concussion issues. So I started coming to treatments.
It has been used for many years to treat traumatic brain injury, and there's an increasing number of studies out there that show that it is very successful in helping people with both post-concussion syndrome and traumatic brain injuries recover from the trauma to their brain.
I've noticed ever since then a significant increase in my ability to focus, my ability to remember. I don't forget lyrics nearly as much anymore. And just in general, just interacting on an everyday basis, that fogginess that prevents me from being able to have a normal life is gone. It'd be neat if veterans knew that, hey, if you've had concussions, if you come home and you're having issues trying to focus, having issues remembering even the little things, you know, there's help. And that's something that I think everybody should know. All veterans should know they don't have to live with the effects of war.
If you've had a doctor help change your life, we'd love to hear about it. Send us an email at info@bestdocsnetwork.com.
That'll do it. That'll wrap up another edition of the Best Docs Network, featuring some of the best doctors in the entire Dallas-Fort Worth area that help change people's lives. And of course, Candace, for more information about any of these outstanding doctors, even request an appointment, head to the website bestdocsnetwork.com.
And don't forget, if you have a question or comment for us, or if there's a doctor that's helped change your life, send us an email at info@bestdocsnetwork.com.
So long, everyone. We will see you next week.